Welcome to Segment 7 of the MyLeap training. My name is Christine Kofke and I'm the Project Coordinator for MyLeap. In this final segment of our training, we will discuss how you can access additional trauma-informed resources for you, your classroom, and your school. First, we will look at school and district level resources. Starting in your school, a great resource is your school mental health professional, whether that is a counselor, a psychologist, or another mental health professional. These individuals are often aware of the resources available to your students and to you if a need occurs. Many school mental health professionals are also aware of the needs of particular students in your classroom and may be able to offer specific assistance for a student. Another great resource that you may have access to is a school or a school district nurse. These medical professionals can help you and your students in a crisis situation, as well as providing information about the resources available to you. School medical staff can connect you or your students to medical resources in the community, such as mental health treatment, suicide prevention, and drug use counseling. Regionally, there are resources provided by your county health department that may be helpful in your classroom. County health department websites contain resources for schools, fact sheets about many issues, clinical resources, and much more. Visit your local health department website or give them a call to find out how your county health department can help you and your students. The Michigan School Health Coordinators Association, or MSHCA, provides assistance to Michigan schools by connecting health teachers to a regional school health coordinator. In fact, 2 health coordinators presented a part of this training. These health coordinators provide you with regional support when implementing the Michigan Model for Health. They are available to help connect you with resources, provide technical assistance, offer training opportunities, and generally support you in your classroom. Visit mishka.org to learn more about MSHCA and connect with your health coordinator. Regional school agencies, such as the Genesee Intermediate School District, GISD, or the Oakland ISD, offer many resources to the schools in their regions, including support for teachers, resources for trauma-informed teaching, and connections to medical treatment in the community. There are many resources offered through organizations that can provide teachers with more information. The National Child Traumatic Stress Network states that their mission is to raise the standard of care and improve access to services for traumatized children, their families, and communities throughout the United States. More information about their mission and resources can be found at nctsn.org. The Substance Abuse and Mental Health Services Administration website not only offers resources about substance abuse and mental health, but is able to connect you with services in your area and provides resources for you or your students to receive help in a crisis situation. This information can be found at samhsa.gov. TraumaSensitiveSchools.org and Trauma-Informed Programs and Practices for Schools, also known as TIPS, have vast resources for you to create a trauma-sensitive classroom and environment. These websites, along with many more, can provide you with a foundation to build a trauma-sensitive classroom and can give you extensive information about a broad range of traumatic topics. If you are interested in more resources for you or your classroom, feel free to reach out to your health coordinator and they can help connect you to anything you're looking for. I would like to acknowledge a few people and organizations that were instrumental in putting this training together. First, the members of the advisory board who helped identify the portions of the Michigan Model for Health that could be problematic for students exposed to trauma and put together the many options for adaptations to support these students. Also, the Michigan School Health Coordinators Association, who worked together with us to develop ways to support teachers and facilitate the successful implementation of MyLeap. Lauren Kazee, the founder of Living Slow, provided us with lots of help learning to support teachers and classrooms. Lastly, the Michigan Department of Health and Human Services and the TIPS team at the University of Michigan, along with Todd Herrincole, who provided many resources and feedback for us as MyLeap grew and developed. Now that you've completed the asynchronous portion of the trauma-informed training, it's time to move to our synchronous component. We will contact you with more information as a date for the synchronous component is set. The second portion of this training will consist of interactive discussion, case studies, and examples that you can apply to your classroom. We will also have a time set aside for answering any questions you may have about Michigan Model for Health, MyLeap, and trauma-informed classrooms. If you have any questions or would like to know more about MyLeap, the project team, or trauma-informed resources, please feel free to reach out to us at myleap@wayne.edu.